Hey folks, Dr. Joe Esposito here. I'm so glad you're with us today. What we're going to talk about today is a multitude of topics. We do shows, we do Sunday night shows, we do Sunday morning shows, we do shows during the week, we do podcasts, and so we do a lot of shows. So what I'm going to do today is cover some of the top topics that we've covered in the past 12 months and give you a recap of those. Now, if you have any questions, you can always send them to us through our website, drjoe.com. Any health questions, we're more than happy to help you out. But the website has over 1,500 hours of podcasts. So if you have a question, you can usually type in what you're looking for at Dr. Joe Esposito, or drjoe.com, I'm sorry, drjoe.com. Type in what you're looking for. We've probably done a show or a podcast or an article on it. If not, you could always send us the question through the website. We're more than happy to answer your questions. We try to get to them right away. So if you type something and one of us is at a computer, we will answer you immediately. If not, we're going to send you an email. Just make sure you put your email address in there, of course. So we will get to you as soon as we see it. This is not something that takes days and weeks to get answers from. So what I want to do is I want to talk about problems that sneak up on you. And these are pretty much what we talk about every day, especially as you're getting older. More than 9 in 10 adults have some type of chronic disease. That's amazing, isn't it? 9 in 10 adults. And almost 8 in 10 have more than one. That's crazy. 1 in 10 have one disease, 8 in 10 have more than 2 chronic diseases. So chances are you'll get one sooner or later, but there's things you can do to lead a healthier life. Now, the nice part is that you don't have to succumb to aging. That's what's so cool. People usually guess that I'm about 20 years younger than I am, which I'm perfectly fine with. And a lot of it has to do, well, all of it has to do with my lifestyle. It's not genetics. I mean, my mother has great genetics, but my family, everyone, my mother's still alive, everyone has died expected times, the usual lifespan. We don't have any people that have lived to be, crazy lengths. Now, my father's mother lived to be about 98. Now, she had 10 kids and it was just never went to the doctors. And she wouldn't even sleep in a hotel room. She wouldn't eat in a restaurant. She didn't trust anybody. But it's really cool that that's really the only link I have in my life to, extreme aging. But there are things you can do to slow it down. Regardless, if you have good genes, all the better. You're going to take advantage of that. If you don't have amazing genes, you can change that. I know last Sunday night, we did a show. We talked about something called epigenetics. Epigenetics are the things that influence your genes aside from just hereditary. So epigenetics would be your diet, your lifestyle, your family, your attitude, your people you're around, your success. So a lot of these are what's called epigenetic factors. And so you can benefit from the epigenetics even if you don't have great genetics, which is kind of cool. So we're going to just go through a bunch of stuff that we covered in the past 12 months, and I'm going to go pretty much in depth on each one of them so you understand what to do. We've done a show on every one of these. So if you go to our website, drjoe.com, just type in whatever topic you're looking for, what we're going to cover today, hit enter on your keyboard, and chances are shows will come up. We have audio, we have video, we have articles, we have blogs. So in fact, Garrett and I were talking the other day. Garrett's my producer, and we were talking the other day that the website has too much information on it. It's hard to navigate sometimes because there's so much information on so many different topics. So we're trying to iron it out for you. And it's a great problem to have because we have so much information. Most websites are struggling for information. Ours is just overloaded with information. So website's a great place to run down a rabbit hole. Sometimes you go to YouTube and end up going down a rabbit hole. Go to our website and run down a rabbit hole and start listening to shows and reading articles, and you'll be amazed how much you'll learn. I've said this before, that even colleges, universities, high schools use these shows as teaching tools. I'll have people send me an email from around the world and say, hey, I'm in Anchorage, Alaska, I'm in Germany, whatever. And you said on your show, you said in your lecture, and I said, what lecture? What? I never lectured in Germany. I was like, oh, no, our teacher uses it in our classroom. So colleges as well. So it's a lot of good information. So let's jump right in. High blood pressure, that's probably the number one question we get, aside from pain. Number one reason we see pain in our patients in our office is pain. Neck pain, back pain, shoulder pain, numbness, tingling. We're really good at that. The number two reason we see people is for digestive issues, heartburn, acid reflux, burping, gas, bloating. But question-wise that come in through the website, because those people right away come in and see us for those. We don't necessarily get those questions on the website. They'll come right in and just make an appointment because they know we're really good at that. High blood pressure. is probably the number one question we get. And we have a show on the website, drjoe.com, on high blood pressure. It's about 2 hours. We go really in depth on what high blood pressure is, the causes, and more importantly, what to do about it. But what happens is as you get older, your blood vessels become less flexible, and that puts pressure on the system that carries blood through your body. Blood vessels are tubes, and they open and they close. They expand and contract. And when they expand or open up, the blood pressure drops. Was it the first law of hydrodynamics or the second law? The bigger the vessel, the wider the tube, whatever, the lower the pressure. So as the blood vessels expand, the pressure drops. And that's done by something called nitric oxide. Nitric, not nitrous. Nitrous is what you get at the dentist. Nitric oxide opens up the blood vessels. It relaxes them. The blood vessels open up and the pressure drops. So it's a real simple thing to do is make sure your nitric oxide is high enough. As you get older, your nitric oxide production plummets. You have much less nitric oxide than you used to. And so the blood vessels, first of all, aren't as flexible, like anything else in life. You're not as flexible as you used to be. And if they can't open up, the blood pressure then can raise. And that's one of the reasons our third most popular supplement on our website is Dr. Joe's Nitric Oxide Support, because it opens up the blood vessels. If you're taking blood pressure medication and you take Dr. Joe's Nitric Oxide Support, monitor your blood pressure. And the reason I say that is I don't want your blood pressure going too low. I know that sounds silly. You have high blood pressure. But I've had this happen where patients are taking a medication, which works very well in most cases to lower blood pressure, and they're taking nitric oxide, which in some cases works. And they say, Doc, I've been taking the nitric oxide. You told me I'm going to have this rush of energy. I'm tired as heck. I just feel so weak. I can't even stand up. I get dizzy when I stand up. It's called postural hypotension because the blood vessels aren't contracting enough to bring blood up to the brain. So I say, listen, you got to cut out either the medicine or the nitric oxide. You got to make that decision or talk to your doctor to make that decision. And of course, we know what the decision is because the nitric oxide, really not a whole lot of side effects. Medication, I'm not against medication, but let's get real, has side effects. Watch any commercial on TV. You know, if you take this medication, all these side effects and more can happen. But take the medicine because a pretty girl's smiling. And again, I'm not against medicine. I'm just being a comedian here. But be careful with that if you're taking some of the supplements because it may get you well enough that you don't need the medication. And I don't say that cynically. I say that honestly because we don't want to mix too much. You know, you may have too big a reaction. So that's what happens with blood pressure. Chiropractic care has been shown to help in many cases of blood pressure. You can adjust the atlas, which is the top bone in the neck, and that many times affects what's called the vagus nerve, and that can affect blood pressure as well. So if you have high blood pressure, there's a lot of things that you can do. Chiropractic care, nitric oxide, of course, got to cut salt out of your diet. Salt retains fluids. The nice part is that you can do, and in fact, I just read this study this week, that potassium chloride, which is a salt substitute, has a salty flavor, but doesn't seem to have the same effects as sodium chloride. The problem with potassium chloride is if you have kidney disease. Your body may not be processing out the potassium, and that could become an issue. So if you have kidney disease, be careful with it, but a substitute for plain old salt might be potassium chloride. And again, that's a new study just out. It's pretty exciting because I love salt. I mean, who doesn't love salt? And a little salt is fine, as long as it's air-dried sea salt or Himalayan salt, but it's still not good. Now, if you're not doing iodized salt, which you shouldn't be doing iodized salt, chances are you're not getting enough iodine, because that really is the only source of iodine most Americans have, or almost the only source. So what I recommend, which is the minimum supplements everybody should be taking, Dr. Joe's Super Greens and Dr. Joe's Essential Source. Those two supplements, minimum, I can't imagine you're not taking these. This is like, drives me insane if you're not taking it because it's the minimum amount of nutrients you need every day. I take them first thing in the morning. I wake up, it's 2 powders. I mix it with some coconut milk. I have a little glass jar. I shake it up and drink it, and I look forward to it. Some people look forward to coffee in the morning. I look forward to my Super Greens and Essential Source. After taking it for about a week or two, chances are you're going to look forward to it too. It's going to be your morning routine. So I want you to consider that as the minimum supplements. I have to throw something in there for vitamin D when I talk about supplements, especially in the winter months, because vitamin D becomes an issue. And vitamin D is so important for the immune system. There are studies now with vitamin D and COVID, and there's benefits to taking vitamin D. So there's a ton of reasons why you should be taking vitamin D. So again, if I had to give you the minimum package of supplements, people say, what should I take? Super Green, Essential Source, vitamin D, and glutathione. Glutathione is great for the immune system. It helps the liver as well. So that would be my starting point. That would be the minimum that I would recommend everybody take. Then we customize additional supplements like nitric oxide. I take it every day. If I take it in the morning, I feel good. If I take it at night, I can't sleep because it gives me too much energy. So just be careful when you take these things. Supplements are important, but they're not candy. They do have benefits, and they're too much or improperly taken or poor quality can have adverse effects. So blood pressure, of course, exercise, lose weight, stop smoking, reduce stress, eat healthy, blah, 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 blah. You know all that. But beyond that, check the nervous system chiropractically. If you have acid reflux or heartburn, burping, gas, bloating, irritable bowel syndrome, Crohn's, colitis, you're affecting something called the vagus nerve. Vagus nerve controls the digestive system. It also has some control over the heart. So there are many patients that if they have a digestive issue, it can cause high blood pressure. So my staff is very well trained, of course. My doctors are, I feel, my opinion, some of the best in the world, if not the best in the world. You can adjust the spine. You can also take the stomach and pull it down away from the diaphragm and get it to relax. Excuse me. When the stomach relaxes, it takes stress off the vagus nerve. So acid reflux, heartburn, burping, gas, bloating, my team is really good at fixing most of those cases. And the reason I know that is I have it. So I have acid reflux, and when mine acts up, I grab one of my doctors, pull the stomach away from the diaphragm, and for me, within seconds, I start to see a difference. Now, it's going to take several visits to get the stomach where it's supposed to be. I can't go to the gym, work out one day and say, look at my muscles. No, it's going to take time. So understand, if you do come in as a patient, it's not a one and done. So if that's what you're expecting, a one and done visit, probably don't even come see us. Don't waste your time, don't waste your money, and don't take up somebody else's appointment, because our appointments fill up pretty quickly. So understand there's going to be a process that goes on if you do become a patient. So high blood pressure is a lot of different things you can do. Diet, stomach issues, vagus nerve, chiropractic care, nitric oxide. I'm getting all excited today. So there's many, many things you can do. And so it's not just, hey, you have high blood pressure, deal with it. Diabetes. 1 in 10 Americans have diabetes. Your chance of getting disease goes up when you get older. Diabetes can lead to heart disease, kidney disease, blindness, other problems. So it's a good idea to, first of all, eat a good diet. If you're eating a good diet, that can usually control your blood sugar. Type 2 diabetics, in most cases, can reduce or eliminate their need for medication if they get on the proper diet. Type 1 diabetes, a little different story. They have a genetic issue. The pancreas is not producing insulin, so they have to take insulin. It keeps them alive. Once again, I'm not against drugs. If you have thyroid disease, you get your thyroid removed, you have to take medication. It is what it is. But there's a lot of things we can do in addition to that. And the beauty of our offices is we merge. In fact, I was just talking to a patient earlier today. She says, I love the fact that you have chiropractic and nutrition, and you work on the organs, and you have a medical division, and you can do PRP, and we can do hormone therapies. And so there's so many options that we offer to our patients. It's more like a one-stop shop. And the reason I do that is I'm a patient too. And so I want to make sure I have access to what I consider the best health care available. People say, well, Dr. Joe, special people have special access to health care. No, they don't. You can go to any doctor you want to. And so at our office, we have those options, and that's what's so cool about what we do in our offices is if you go to our website, drjoe.com, just click on the services button, tab on the top, and it'll drop down a list of services that we offer, which is kind of cool. But with diabetes, nutrition, folks, you got to do it. Bottom line, if you have type 2 diabetes, you got to stabilize that blood sugar. Because what happens is with type 2 diabetes, you're producing insulin, but you're not utilizing the insulin. So usually with type 2 diabetics, the insulin is too high or can be too high. And so we can give you more insulin sometimes to force the insulin into the cells. And the way insulin works is insulin is like a key. It goes into the cell, opens up the cell, and allows glucose or sugar into the cell. If you eat a lot of sugar, you produce a lot of insulin. If you produce a lot of insulin, the cells become resistant to insulin. The cells say, I can't take any more sugar. Stop trying to open me up. And so it doesn't let the key open up the cell anymore, and then you become insulin resistant. Insulin not only opens up cells, it's a growth factor. And so if you have cancer, it can actually stimulate cancer growth. This is another reason why I'm begging everybody, cut out the sugar, folks. Because if you have cancer, the sugar's going to make it worse in most cases because of insulin and the sugar itself feeds cancer cells. But the other thing is that sugar can make you gain weight. And if you have excess weight, fat produces estrogen. Estrogen causes you to lay down fat, which then produces estrogen, which causes you to lay down fat. So fat becomes a living, breathing organ. It's called an endocrine organ. Actually, it produces its own hormones. And so I was talking to a patient today, and he's short and, Humpty Dumpty build. And he says, Doc, I got to start listening to you. I said, I don't think you have much of a choice. You have to start listening to me because he's 70 years old, he's overweight, and I'm concerned. I love my patients, and I'm very concerned about his health. So we have something called a 21-day doctor-supervised weight loss or doctor-supervised cleanse. And for 21 days, we have menus laid out for you. You take supplements, and it kind of flushes out the system and reboots the brain. Because the brain is craving sugar all the time. Brain loves sugar. And so if I can reboot your brain and settle down those cravings, in many cases, you're able to control what you're eating. So we have a protocol for that. We get you on a 21-day cleanse, and then we get you on other supplements, and we get you on a good diet, and we get you into chiropractic care. We have medical if we need medical care. So we're looking at multiple different ways to treat you. And that's what we do with outpatients. Now, again, if you're on insulin, stay on insulin. If you're taking medication, stay on medication. I never tell a patient to come off their medication. My goal is to get them well enough so we don't need the medication. So it's a different approach. It's getting to the cause of the problem, not just treating the symptoms. Sometimes you have to treat the symptoms to get you through, and I'm fine with that. Treat the symptoms, and then we can go ahead and then get to the cause, and then you won't have to treat symptoms anymore. So it's kind of a neat little approach. It's the holistic approach, treating the whole body and getting the body as well as it can. There's a great supplement I do recommend. It's not on the website yet. We are going to put it on there soon. Garrett's telling me next year we'll be able to put it on there, called Gymnema. Gymnema stabilizes your blood sugar, and it works great for sugar cravings. One of my very dear person in my life, she said, I'm just not craving sugar like I used to. And I said, really? And she eats well. She's vegan, and she's very healthy and very beautiful. And she said, I'm not craving sugar like I used to. It's really kind of cool. And I said, what are you doing differently? She goes, well, I started taking Super Greens Essential Source. And then she paused, and she said, and Gymnema. I said, yes. So sometimes the Super Greens and Essential Source is all you need. Many times patients say, Doc, I'm getting the Super Greens and Essential Source. I feel great. I don't need to be, I'm lowering my medication. My energy's back. I'm not eating as much. Then sometimes we got to throw the Gymnema in as a boost. Because again, everybody's different. And that's why when we start a protocol, a nutrition protocol with our patients, I always say, I want to own you for 60 days. I want you to do everything I say for 60 days. And at the end of 60 days, let's reevaluate and see how we're doing. And then we might modify it. Maybe you don't need this supplement anymore. Maybe that problem's solved. Maybe we need to change something. Maybe we need to reduce it. So it's a dynamic thing. You don't take the same thing forever. Like with Super Greens and Essential Source, I'll take forever. Digestive enzymes, I take them every day when I eat a cooked meal. So that's part of life, getting older. I take omega-3 fatty acids because I'm a vegan, and I get my omega-3 fatty acids from an outside. We all get it from an outside source, but I get it because they're not. Omega-3 fatty acids are found in plants, but I don't think there's enough in plants. Now, your body can convert it sometimes, but I take an extra boost. I take B-complex just because I live a very high stressful life. Not good stress, but it's stressful. I take adrenal support because as you get older, the adrenal glands get weak. I take nitric oxide to open up my blood vessels and increase circulation. So I've got several other supplements. I have a little pill box. And if you come in as a patient, if you ask, I'll give you a little pill box. And it has 7-day dividers in it, and you can put in your supplements. But I can't imagine a day without my supplements. And I couldn't imagine. And once you start doing it, and your energy level goes up, and you feel better, and your love life improves, and your brain function improves, and you sleep better, you'll go, wow, this is really cool. I should do more of this. So that's what I want you to do. I want you to get how important it is to feel good. And when you start supplementing your body, you're pretty amazed what's going to happen. So diabetes, again, a lot of it is manageable, and a lot of it is self-induced, just like high blood pressure. Many times it's self-induced. High cholesterol. 1 in 100 people have genetically high cholesterol. 99 out of 100 would benefit from a dietary and neurological protocol. Neurological, I mean chiropractic, making the nervous system work, fixing the digestive system, getting the diet fixed. 99 out of 100. And we know, let's say diabetes, going to heart disease now. Heart disease, #1 killer. There are so many studies out there that prove that going to a plant-based diet reduces your risk of heart disease dramatically. Esselstyn has done it. a bunch of other, I can't think of the names right now. I can picture them now because I know them. Sinatra's done it. There's so many studies out there that show with heart disease, we found what would be considered a cure in the medical world. And yet nobody talks about it. Take this pill, your blood pressure's high, well, you got heart disease. It is what it is. Maybe we have to do a quadruple bypass surgery. And if you need it, get it. But at least give this natural approach a shot. If it doesn't work, it doesn't work. So what? You ate well for a couple of months. But if it works, which it does, then you'll say, wow, I saved money, I feel better, I probably added a bunch of years to my life, my energy's improved, my love life improves, I feel younger, my family likes me better, I'm a better husband, father, brother, sister, whatever you are, all because I just changed my diet and saved money in the process. Why wouldn't I do that? And the answer is, I don't know. I don't have your answer for that. If meatball sandwiches made you healthy, I would be eating meatball sandwiches. I promise you. I'm Italian. I miss them. I hadn't had one in 35 years. But there are vegan meatball sandwiches you can do. I'll be honest with you. I miss my grandmother's meatballs. But it's not worth it. And when I see the miracles that happen every single day with our patients, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. When I see the miracles happen every single day with our patients, and they come to me crying every day, I would say at least once a day, a patient cries in my presence with joy. Thank you, Dr. Joe. Thank you for changing my life. Thank you for showing me this way. Thank you for helping my child. It's the greatest job in the world. This morning, a patient ran up to me. I'd never met him before. He's seen one of my other doctors. He runs up to me and says, oh my God, I need your picture. Guy's 70 years old. He says, I'm going to make my wife so jealous. Took a picture, a selfie of me and him. How cool is that? 70-year-old guy getting excited to take a picture. So that's so neat. And that's why I do what I do. And that's why after 37 years, well, 38 years coming up soon, why do I still get excited? Because you guys, the patients, are getting such great results. And that's why if you do have questions, go to our website, drjoe.com, and you can type in what you're looking for or send us the question through the website, and we're more than happy to answer it. All the supplements I talked about, the super greens, the essential source, the omega-3s, the B complexes, the enzymes, the vitamin Ds, the glutathione, they're all on the website, drjoe.com. You can order them right online, or you can come pick them up. If you come to our offices, you don't have to pay shipping. And I'm more than happy to save money and not pay the post office, because the post office is getting a little crazy. They're not delivering like they used to. They can't keep up with demand. And that's okay. What a great problem to have for them. Bad problem for you. So what we want to do is solve that. Come to our offices. And while you're there, make an appointment. Or just make an appointment. Come in and pick up the supplements. If you have a health issue, neck pain, back pain, shoulder pain, headaches, numbness, tingling, peripheral neuropathy, you've ever been in a car accident, if the car was damaged, you were damaged 100% of the time, make an appointment to come see us. The initial visit is normally $375. We've reduced that to $199. Now, we can't do this forever, of course, because we'll go broke, but it's an exam, x-rays, consultation, and your first adjustment. On the second visit, we do a report. We go over the x-rays and the exam findings, and we do a nutritional evaluation. $199. The nutrition alone is $150. Now, again, we can't do this forever, but treatment beyond that, if you do get a second treatment and beyond, insurance, we accept most insurances, or we match your insurance benefits, car accidents, sports injuries, workers' comp injuries. We want to be your doctors. And then if you're interested in PRP, our medical services, PRP is we take your own your own cells and re-inject it back into the body to stimulate new growth. It's pretty amazing. It helps with inflammation, arthritis, erectile dysfunction. The results are crazy good with erectile dysfunction. Women that leak urine. I had a patient today, 32 years old, because when I cough, I leak urine. I said, you probably want to get a PRP shot, and we can put it right into the area to tighten up the muscles. So if you'd like to make an appointment, drjoe.com, drjoe.com. You can book it right online if you want to, or if you have questions, call us. We want to be your doctors. Our goal is get you well and keep you well. Folks, I'm Dr. Joe Esposito. Again, the website, drjoe.com. Tell your friends about the show. Don't go anywhere. We're going to be right back. Hey folks, Dr. Joe Esposito here. I am so glad you're with us. If you're just joining us, welcome. If you stayed with us, thank you. I'm glad you stayed with us. I always love the fact that you guys are spending a little time with me. And hopefully every show you walk away with information and say, that makes sense. And that's the biggest compliment I get. I always laugh. I said, I want a woman to whisper those 3 little special words in my ear. That makes sense. Because everything we talk about in healthcare makes sense. We give you the options of how to treat things without drugs and surgery. And again, if you need drugs and surgery, absolutely use them. But in most cases, if you do what we say, you're not going to need a whole lot of drugs and surgery. If you need them, take them. But I want to reduce or eliminate the need for drugs and surgery in your life. May not be able to do it, but if I can reduce it, if nothing else, you'll save a ton of money, probably live a lot longer, feel better. And so there's no downside to getting healthy. That's the cool part about this. There's really no downside to getting well and staying well. You'll save money, you'll live longer, you feel better, your love life improves, you sleep better. Again, I can go on and on and on of all the benefits. So what we're talking about today are some of the hot topics we've had over the past 12 months and kind of give you a recap of each one of the topics. If you have questions, you can go to our website, drjoe.com, and you can send us a question. There's a little pop-up that says, hi, would you like to chat? Many times someone's live. It's either me or Garrett or Joe or Sierra, and we'll get right back to you immediately. If not, we will get back to you, because some people say, hello, anybody there? Oh, great, nobody's there. That's what they'll type in. It's like, well, we can't monitor the website 24 hours a day, because I guess we could, but I got to sleep at some point. So we will get back to you as soon as we possibly can, I promise you. So, all right, so we talked a little bit about, high blood pressure, diabetes, heart disease. We have the answer, okay? The answer is really simple. Go to a plant-based diet. With heart disease, the studies have been clear as day that show that a plant-based diet can reduce or eliminate most heart disease patients' issues. So why wouldn't you do it? Well, I don't want to give up my cheese. I don't want to give up my booze. I don't want to give up my meatballs. Okay, it's your choice what you decide to do, of course. But why wouldn't you do it? I have patients that are just miserable on oxygen. And they say, well, doc, I'm not going to change my diet. Okay, it's your choice. But I can't imagine if I was on oxygen, I wouldn't be doing everything I possibly can to get well. I'm not asking you to run a marathon. I'm not asking you to paint my house. I'm not asking you to change my flat tire. I'm asking you to just change what you eat. And you have to eat anyway. Why not eat good food? That's the cool part. There's so much good food out there. And if you don't know what to eat, on our website, drjoe.com, we have a show, actually a lecture I did called So What Can I Eat? Just type in So What Can I Eat? It'll pop up in the search bar and you can listen to it. The first book I ever wrote was really a great guide on what to eat called Eating Right for the Health of It. And first part of the book tells you how to change your diet. Second half is recipes, over 200 recipes. And everything is in there that you can possibly imagine. Breakfast, lunches, dinner, snacks, salad dressing, soups. I got desserts in there. I got appetizers in there. So there's no reason why if you shouldn't change your diet, because now you have the tools to do it. So here's my challenge. Make every recipe in the book. And if you don't feel better, I lied to you. And you wasted whatever it is, $16 for the book. But if I'm right, which of course I am, you'll say, oh my gosh, Dr. Joe, thank you. You saved my life. And that's the reason I get excited every day when patients say thank you. And the only issues we ever have with patients is when they don't follow our advice. I know I had a case the other day. He was in a car accident. And I always say, if you're in a car accident, come see us immediately. And he came in for 3 visits over 3 months. That's not nearly enough. And the insurance company offered him $1,000 to settle, and he took it. Now, this guy could barely walk. He couldn't even get on our table. We had to help him to get on our tables. He settled the case. It's done. He compromised his health for, penance. It sounds like what Judas did. A couple of pieces of silver. And I thought, what are you, crazy? Oh, doc, I could use that money. But you can't walk. Drives me nuts. So the only time we ever have patients, and it's extremely rare, is when patients don't follow our advice. That's really one of the few times we ever have issues with patients. So if you want to become a patient, we'd love to have you as a patient, because we want to do the nervous system, the digestive system, and your diet. Those are the 3 things you need to get well. And, we talk about heart disease, #1 killer. So if we had a pill that said, okay, if you take this, the success rate is going to be astronomical when it comes to reducing pick disease, diabetes, heart disease, cancer, whatever it is. Would you buy that pill? Absolutely. What would you pay for it? Anything. Doesn't matter what I charge you, you would buy it from me. And yet, people don't do something simple that's free by simply changing their diet, making sure the nervous system is working properly, making sure the digestive system is working properly. I would say if you go to a plant-based diet, you can add about 11 quality years to your life. If you just give up dairy, 8 quality years. And yet people won't do it. But if I had a pill to sell them, they would take it. So anyway, that leads me into my next topic that we've covered a lot, obesity. How many people are overweight? Raise your hands. 65% of you should have raised your hands. And as you get older, if you're older, it's really hard to lose weight because your metabolism changes. It's called aging. It's okay. So you and I have to be even more strict about it. Garrett and I joke about this a lot. He's much younger than me, and he says, I'm waiting for the day when I just can't get away with eating whatever I want. And it's going to happen. It has to happen. It's part of nature. I mean, it's going to happen. And so when it's happening to you and you're having a hard time losing weight, that's when you really want to say, okay, I got to crack down. I got to listen to what Dr. Joe says. And you can live this lifestyle, folks. It is not hard. It's extremely inexpensive. You feel great. Your kitchen is so much cleaner. You're not frying meats and other foods that'll stink up your kitchen. I can't imagine why people wouldn't do this. It just blows my mind. Now, I remember bad foods taste good. I was normal once. And I remember those things. But we were talking the other day about drinking, and somebody brought one of my doctors in a bottle of, I don't know, some type of whiskey or something like that. And I remember the last time I had a drink, I was 29 years old. And I was on vacation, and they sent a bottle of champagne to my room, and I had one glass of champagne. And I felt awful. And I thought, I'm on vacation, and I just ruined a half a day of my vacation recuperating from drinking a small little flute of champagne. And I said, it's not worth it to me. And that was my decision, not worth it to me. So if heart disease and diabetes and cancer and obesity and high blood pressure and osteoarthritis, if these are worth it to you, then continue absolutely with your lifestyle. But if it's not worth it, if you're sick and tired of suffering, make a move, do something, do anything. If nothing else, start taking super greens and essential source, step one. Then add the vitamin D to keep your immune system strong. Then you start listening to Dr. Joe's shows, and I want to re-brainwash your brain, or unwash your brain, I don't know what the right word is, about every commercial you see and how you need to eat more of these chips and how you need to maybe take this medication. And sometimes you do, but many times we don't. So with obesity, it's linked to 20 chronic diseases, including heart disease, stroke, diabetes, cancer, high blood pressure, osteoarthritis. 45% of Americans between 40 and 59 are obese. I've seen those statistics as high as 65%. So it's not hard, it's easy, and here's my secret. Everyone wants to know, Dr. Joe, give it to me quick. What do I have to do? I don't want to do any work. What's the one little magic pill, one little tidbit, one pearl of knowledge you can give me to lose weight? Here it is. Get the bad food out of the house. If it's in the house, you're going to eat it. How often? 100% of the time. I was given a bag of these chips that were made with beans. And they were lower in carbs and higher in fiber, and they were really good. And it was a small bag. And you know what I did? I ate the whole bag. Because they were good. Why? Because they were in the house. If they weren't in the house, I wouldn't have eaten it. So, of course, I eat a really good diet anyway, so I eat a lot of fruits and vegetables and a high-fiber diet. So it didn't have a huge impact on my life. But I knew that if it's in the house, I'm going to eat it. So you have to get the bad food out of the house. Not tomorrow, not once you eat up what's in the freezer, not after the pantry's cleaned out, not after the big sale that happened at the grocery store and you bought all the junk food on sale because it was half price because it was after the holidays. No. Get it out of the house now. I actually have a stream in my backyard, and I've already thrown food into the stream because I know if it's in the stream, I can't eat it. It's just that simple. So that's how I'm like you. My brain works like you. I eat sugars, I eat bad foods, and it stimulates the nucleus accumbens, which releases dopamine, and I get high from it. So you've got to get the bad foods out of the house. And you have to start when? Now. Don't wait till next week, after the party, after the birthday, after the celebration, after the holiday. No, now. Because every time you add more junk to the body, you're affecting the brain. We do a 21-day cleanse at our office, and it kind of resets the brain. And that's something I really recommend for people. If you just can't do it on your own, let's jumpstart the brain on a 21-day cleanse. So we have that. It's on the website, drjoe.com. Other topics we talked a lot about in the past several months. Osteoarthritis. Osteoarthritis is a mechanical issue. What that means is bones are out of place rubbing up against each other. And as the bones rub up against each other, the body produces a specific white blood cell. And that type of white blood cell goes in and attacks the inflammation. So it helps bring down the swelling. That's great. But it also eats away at the joint. And those white blood cells are not site-specific. What that means is they don't go to just one place. They go all over the body. And so they're attacking all the joints. And the joints, like big joints, like your hip, let's say, really aren't going to be that affected by these little white blood cells. Now, over time, they will be. But the weakest, most movable joints in your body are really going to show the impact. Where are the weakest, most movable joints in your body? Your fingers. So people come in and I'll say something about arthritis. I'll say, oh, Dr. Joe, look at my fingers. I got arthritis in my fingers. Chances are that's not a primary site. It's a secondary site. So you have an injury somewhere else in your body. Maybe it's a whiplash from a car accident. If your car's damaged, folks, you get a whiplash. Everyone does. So even if you don't get treated for it, I promise you, it's going to become a problem later on in life. It has to. So The fingers are swollen because the white blood cells are attacking those joints, so it's not the primary site. I mean, if you jam your finger playing volleyball or something, yeah, that could be a primary site. But what I do with patients like that, I say, let's do an evaluation of your body. And inevitably, 100% of the time, I find a central arthritic area. Maybe it's the neck, maybe it's the knee, maybe it's the foot. We have to address the cause, the primary site, and the secondary sites. And then we get you on an anti-inflammatory diet because osteoarthritis is, like I said, mechanical. Now, there is a chemical component. The mechanical causes the body to react and cause inflammation. But there's always an initiating factor of mechanical. And that's where chiropractic care comes in. Chiropractors are very, very good at putting bones back in place. So it's a neck bone, a foot bone, a hand bone, a skull bone. My staff are all trained to actually adjust the skull. A knee issue. How many of you hurt your knees? How many twisted your ankles? All these issues can have long-term effects if you don't put the bones back in place. So my staff is trained to adjust from head to toe, all 206 bones in the body. So with osteoarthritis, we always got to get to the cause of the problem, not just treat the symptoms. Because again, if a bone is out of place and you don't put it back in place, it's going to wear out. How often? 100% of the time. So osteoarthritis is a real easy one. Find out where it's coming from, put it back in place, and then get on an anti-inflammatory diet. Osteoporosis. This is different than osteoarthritis. Osteoporosis is when the bones lose their structure. They get thinner. And you're more susceptible to fracture when you have osteoporosis because the bones are thinner. It affects about 54 million Americans, usually over 50. A couple of things that can help. Diet. Now, here's the thing. What's the first supplement you think of with osteoporosis? Calcium, right? Got to take calcium, got to take calcium. Build up those bones, got to take my calcium. Here's the problem. If you take calcium and you don't have enough vitamin D helps you absorb the calcium. Vitamin K2 tells the calcium where to go once it's absorbed. So calcium needs vitamin D needs vitamin K2. Now, we produce vitamin K2 in our bodies. However, in my vitamin D3, I also add vitamin K2 because it helps the D3 work more effectively. So I take Dr. Joe's vitamin D3 every day. I take 5 drops, which is 5,000 international units. I suggest you do too. Now, it's a good idea to get your blood tested to make sure you have enough vitamin D. I like my patients between 60 and 80 nanograms per milliliter. If you're below that, I don't consider that optimal. Now, the standard optimal is about 30 nanograms per milliliter. That's the standard. I don't think it's high enough. I think that's enough maybe to keep you alive, but not to thrive. And so I want to make sure you're getting those vitamin D levels up there. And it's so easy. It's so inexpensive. I always say it's the cheapest insurance policy you'll ever buy. Especially cold and flu season, COVID season, you'd want to be taking those vitamin D supplements every single day. 5 drops, I squirt it into my Super Greens and Essential Source. So I got a little jar. I take a scoop of Super Greens, scoop of Essential Source, some coconut milk or almond milk, shake it up. You can put it in your mouth if you want to. It has no flavor. And I'll just squirt it in there. It's part of my daily routine. My morning, I'm boiling water for my ginger tea, and I take the Super Greens, Essential Source, and vitamin D, chug it right down. Great way to start the day. You feel good. It's refreshing, and it gives you a ton of energy as well. And again, may not give you energy the first day. It may take a few days to get that in there. So it's not like you can take Super Greens and Essential Source and so I didn't see anything happen. It's happening. It just takes time for the body to respond. So don't lose faith. Give it a few days. Give it a few weeks. You're going to see some good results there. So osteoporosis many times is avoidable. It's usually due to a high-acid diet. If you're eating a lot of alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener, what are they called? Say it with me. The 7 deadly sins. 7 deadly sins of nutrition: alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. If you're eating the 7 deadly sins, you're eating a high-acid diet. When you put acid in your body, the body has to neutralize that acid. The body uses calcium as its primary neutralizing agent. So the body is giving up calcium from the bones to neutralize the acids. So if you go to an alkaline diet, fruits, vegetables, nuts, and seeds, now you're able to absorb that calcium, put it into the bones where it belongs, and then you're in good shape. It's very, very rare I've ever seen, I can't think of anyone I've ever met who eats a plant-based diet who has osteoporosis or heart disease or diabetes. Extremely rare for that to happen. Can it happen? I guess it could. But, you know, if you play any odds, plant-based diet is the way to go. And again, if you don't know what to eat, go to our website, drjoe.com. listen to the show we did. First, listen to the 7 Deadly Sins of Nutrition, that show. And we talked about alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. It's a lecture I did in California a couple of years ago. It was a lot of fun. We had a great audience, and we had a guest panel. There's a lot of famous people there. It was kind of cool to meet a lot of famous folks, and I was the guest speaker. And then you want to listen to So What Can I Eat? And So What Can I Eat tells you what to eat. My book, Eating Right for the Health of It, is a great guide. If you're looking to really jumpstart everything, the 21-day cleanse or 21-day detox, 21-day weight loss program, it's all the same thing. It's on the website, drjoe.com. Look under services. Services, weight loss, there it is. And we can get you on that too. A lot of people do that beginning of the year. They kick off their new year with the 21-day protocol, and it's really successful because you're in that mode. You're excited. It's a new year. It's a new me. And once you get it rolling, many times that's the impetus that you need to get the body functioning where it should be. So that's all on the website, drjoe.com. And again, all the shows we've talked about here, we've done shows on up to this point. Now, I want to talk about hearing loss real quick. My father was deaf. My father fell off a ladder a few months before I was born, broke his back, fractured his skull, went deaf immediately. My father never heard my voice. And what a guy, because he would come to my plays. I was an actor, surprise, surprise. High school, college, I did a lot of acting. And my father would come to the plays. He'd come to my football games. He'd come to my swim meets. He'd come to my hockey games. And he sat in the audience. And after every play, oh, Joey, that was good. That was like Broadway quality. That was great. And I'm thinking, I used to joke with him, how do you know you couldn't hear anything? He goes, I know. Wow, you're good. But my father was deaf. So I was hoping, the reason I became a chiropractor actually is I planned on being a neurosurgeon. And I spoke to different neurosurgeons. I was 15, 16, I guess. So my thought was my father fell, broke his head, broke his skull, and went deaf. Maybe it's a nerve issue. I can go in there and do surgery and bring my father's hearing back. Kind of a grand goal for a teenage boy. But I started talking to different doctors. And every one of them said the same thing. Don't do it. It's a lot of work. It's late hours. It's blood. And this is back when insurance companies actually paid doctors and people got dressed up to go to the doctors. And then I remember walking into a chiropractor's office because my grandmother said, why don't you go talk to my chiropractor? They do something with nerves. And I said, oh, okay. And I remember I had hair down to my shoulders, 210 pounds, T-shirt with a flannel shirt open, Wrangler blue jeans, and work boots, and a beard. And I walked into this chiropractor's office on Patterson Ave in East Rutherford, New Jersey, and he couldn't have been nicer. Didn't know who he was. Just walked in, chiropractor, I don't know what that is. And I walk in, and he explained chiropractic and the nervous system and getting to the cause of the problem. He had charts and diagrams and arrows. And he said, if you need ideas to go to school, go to Life University in Marietta, Georgia. It's the best one in the world. And I'll write you a recommendation letter. And I was like, this guy's really nice. So I went to go talk to another chiropractor. He loved his job. So I thought, this is really cool. I like these guys. So it wasn't really about philosophy at that time. It was about, I like these guys, and it was kind of fitting into my mode. I liked the idea of getting to the cause of problems. So I said to my mother, Mom, I want to become a chiropractor. And she said, I don't care if you become a garbage man. Just be the best garbage man you could possibly be. So I was told by my mother that I had to become the best I could be. And the last time I saw my grandfather, he was visiting relatives in Alabama. I went out to Alabama. I was in school at the time. And as I left, he said, you become the best doctor you can be. And I said, okay, Upa, German, Upa. The next day he passed away. He passed away that night, actually. So it was the last words he ever said to me. So I have a drive to be the best I can possibly be. And then I heard about the first chiropractic adjustment ever, September 18th, 1895, Davenport, Iowa. Dr. D.D. Palmer, his janitor, felt his neck pop years ago and he went deaf. So Dr. Palmer thought, well, if I unpop his neck, maybe he'll bring his hearing back. And he did. He adjusted the first adjustment ever on a wash bench, according to the story. And Dee Dee Harvey Lillard was the janitor. Harvey Lillard heard the horse carriages in the street, as the story goes. So September 18th, 1895 changed my life because I said, oh my gosh, he adjusted somebody who was deaf, brought his hearing back. And so that's it. Obviously, I'm meant to be a chiropractor. In my career, I've had three patients, I think, get their hearing back through chiropractic care. My father never got his hearing back. His entire life, he was deaf. But what that says is that the nervous system controls everything. So when people ask me questions, do you think chiropractic care and nutrition and digestion would help my blank? The answer up to this point has always been yes, because I've never known it not to help somebody. Now, it may not cure everything. I'm not saying I have a cure-all. But what I am saying, if you have the nervous system working and the digestive system working and a good diet, good supplementation falls under good diet, it's pretty amazing what happens. And I've seen it happen thousands and thousands and thousands of times in my 38 years now in practice. So if you really want to get well, if you're serious about wanting to get well, I can go through other things. I had a list. I want to talk about cancer and bladder problems and dementia and back pain and depression. All that's on the website, drjoe.com. Just type in what you're looking for. We've covered a show. But I wanted to tell you that no matter how long I've been in practice, every year the same issues keep coming up. And the same treatment keeps coming up. Now, again, we have medical. We have a doctor who can do pain injections into the spine, into the foot, into the knee, into the wrist. So we can do injections if we need to. We can do medication if we need to. We can do PRP. PRP is platelet-rich plasma that stimulates the healing process in your own body. It's your own blood cells. We take your blood cells out of your body, spin them down, inject them back into the body, and it stimulates a healing cascade, we call it. So we use your own body, not stem cells from some baby somewhere or some injections or drugs. So we can do PRP, and it's great for hair restoration. It's great for wrinkles. It's great for erectile dysfunction. For women that have leaky bladder or weakened vagina areas, we can do this right into the area. We can do it in arthritis, knee arthritis. Folks, if you have knee or shoulder or foot arthritis, please consider chiropractic and PRP first. If it doesn't work, you can always have surgery. But I want you to do it right the first time. Less expensive and many times more effective than other treatments. And again, it may not be best for you, but we can make that decision when you come in. So I would love the opportunity for you to say, Dr. Joe, new year, new me, I'm ready to get well and stay well. So if you have health issues, neck pain, back pain, headaches, numbness, tingling, sciatica, peripheral neuropathy, come see us. Stop suffering needlessly. And again, I can't promise anything, but you can make an appointment right online, right on the website. It's a picture of me, and right next to it says appointments. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. We would love to be your doctors. The initial visit used to be $375. We've reduced it to $199. Exam, x-rays, consultation, first adjustment, then going over your x-rays on the next visit, and a nutrition evaluation. And then if we do need more treatment after that, my staff will come in and talk to you about a treatment plan. We accept most insurances. Again, if you've ever been in a car accident, if the car was damaged, you were damaged. Come see us and stop suffering. Bring your kids. Kids have spines too. I've adjusted a baby as young as probably about 8 minutes old. Out of the womb, wiped off, and I adjusted her. So there's no reason why you should be suffering in the upcoming year. And that goes for your family as well. Now, can we promise everything? No, we can't, but the results we usually get are just spectacular. If the VA, if you're a military person, if the VA doctor refers you to us, from what I understand, the VA will then cover your treatment. So if you're in the VA, a lot of people say, I have issues from military service, and thank you for your service. It's pretty amazing that now the VA is saying, you know what, chiropractic is amazing. VA even covers PRP from what I understand for some doctors. I'm not sure if it covers all of it. But the VA is becoming so progressive and saying, you know what, maybe we should be considering these, I hate to say alternative, options for our people because they work. If they didn't work, they wouldn't be around since 1895. So if you're ready to get well, if you want to lose weight, if you have digestive issues, if you have health issues, come see us and let's see if we can help you. I would love the opportunity to work with you. Again, the website, drjoe.com. All the supplements we talked about are available on the website, Super Green Essential Source, vitamin D, nitric oxide, all on the website. Or come see us and pick it up and it'll save you some shipping. So again, go to the website, drjoe.com. If you have any questions, let us know. Thanks for listening. We'll catch you next time.